What is osteoporosis? Osteoporosis is a bone disease caused by loss of calcium and phosphate from the bones. It results in decreased bone density, and it causes weakened bones and an increased vulnerability to fractures. What are 5 signs and symptoms of osteoporosis? Back pain, loss of height over time, a stooped posture, a bone that breaks more easily than expected, and decreased spinal movement with flexion more limited than extension. What are 5 risk factors for osteoporosis? A mild, prolonged negative calcium balance, increased age, female sex, previous fracture, or white or Asian ethnicity. What are 5 interventions to prevent osteoporosis? First, engage in regular exercise, intake enough calcium and vitamin D, eat a well-balanced diet, avoid smoking, and limit alcohol to 2 to 3 drinks per day. How is osteoporosis diagnosed? More than likely, your doctor will order a bone density scan. This exam measures the bone mineral density. It is usually performed using a DEXA or bone densitometry. What are 7 nursing interventions to manage osteoporosis? First, careful positioning, ambulation, and participation in the prescribed exercises should be encouraged, like performing passive range of motion exercises. Give prescribed medications such as biphosphonates and analgesics. Give the biphosphonates first thing in the morning before any other fluid, or medications with a full glass of water. Ensure that the patient remains upright for at least 30 minutes. Assist the patient in the application of heat to areas as appropriate. Inspect the skin before, during, and after the heat application to reduce the risk of thermal injury. Reassess and respond to the patient's pain by evaluating the response to the treatment and progress toward the pain management and goals. Encourage a diet high in calcium and vitamin D. Provide the patient with suggestions for appropriate food choices, and enlist the aid of a dietitian to assist with meal planning and food selection. Treat the patient's pain as needed and ordered using non-pharmacologic, pharmacologic, and a combination of both approaches. Screen for and assess the patient's pain using facility-defined criteria that are consistent with the patient's age, condition, and ability to understand. What is the therapeutic use of biphosphonates in treating osteoporosis, and how should you tell the patient to take this medication? They slow down the bone breakdown, they effectively maintain bone density, and decrease the risk of breaking a bone as a result of osteoporosis. This medication can be given orally or in an infusion. Some oral medications are weekly or monthly, and some infusions are either once every 3 months or once a year. What is the therapeutic use of vitamin D and calcium in treating osteoporosis, and how should you tell the patient to take this medication? Vitamin D and calcium are used for the health and maintenance of bones. Calcium is used to help maintain the balance of plasma levels. Vitamin D's primary function is to regulate intestinal calcium absorption and stimulation of bone resorption, which leads to the maintenance of serum calcium concentration. The best way to receive these nutrients is through a proper diet, otherwise these can be received through a daily pill. What therapeutic procedures are available to manage osteoporosis? Open reduction and internal fixation for fractures, percutaneous vertebroplasty, and kyphoplasty are all available. What is a complication of osteoporosis? The most serious complication of osteoporosis is bone fractures, especially in the spine or hip.